Welcome to this edition of AFMC.
I'll tell you how I got better. I'm
Glad to be here.
But a mission to
Delivery
improve.
of Well, I think that we're going to talk about everybody's.
Arkansas is the second highest prescriber.
Welcome to this episode of AFMC TV. I'm Robin Ledbetter. Thank you for joining us. Today I have with me Dr. Stacy Smith-Foley. She is the medical director of the Breast Center at CARTI and board certified in diagnostic radiology with a subspecialty in breast imaging. Dr. Smith-Foley, thank you so much for joining me today.
Thank you so much for having me, Robin.
So let's just dive right in. Tell me, when should women start getting mammograms? What average age should that start?
So if you don't have any family history, you should begin your journey with mammograms at age 40, and you should continue to get mammograms on a yearly basis.
What can be considered high risk?
So if you've got some family history, it's really important to have a conversation with your doctor by the time you're 25, so we can identify those patients who have the greatest risk. But the term high risk really identifies patients with a 20% or greater estimated lifetime risk.
And there are some newest guidelines too that kind of play into that.
Yes, the new guidelines encourage women of all backgrounds, but particularly women of color or women of Ashkenazi Jewish descent, to have a conversation or a risk assessment with either their primary care physician or their gynecologist by the time they're 25. So patients in those populations are more likely to develop breast cancer at a younger age, and as such, they should probably start screening before age 40. So the goal with that conversation is to try to identify those patients at the greatest risk so we can start screening them earlier.
And there is a high-risk clinic in the breast center as well?
There is. We have a cancer genetics risk management clinic here at CARTI Cancer Center in Little Rock, and it's comprised of a nurse practitioner as well as several genetic counselors.
And tell us about the breast center itself. Can you do all types of screenings there?
Yes, we are a comprehensive breast imaging center. We offer screening mammograms as well as diagnostic imaging with mammograms, ultrasounds. We do high-risk surveillance with breast MRI, as well as needle-guided biopsies of any imaging modality.
In October is Breast Cancer Awareness Month, and you guys are doing a lot of really, really neat things, programs and stuff. Tell us what is going on at the Breast Center, and what do you want people to know?
Well, October is kind of the month that we shine because there's a lot more focus on what we do. But one of the things we're doing in the month of October is we're offering screening appointments on Saturdays throughout the month of October. And we're highlighting one of our 4 centers each Saturday to offer these screenings so that patients can get a screening mammogram at a convenient time in their community. We offered screenings in Russellville last week. This weekend will be North Little Rock. The following weekend will be Little Rock. And then the last Saturday of the month, we will be offering screenings in Pine Bluff.
And does insurance cover these types of screenings? And does that also affect high-risk patients?
Insurance covers screening mammograms at 100%. It's considered as part of your general wellness benefit. You may need to check with your insurance company to see at what age that kicks in, but generally it kicks in for most women at age 40. It can also cover some of the high-risk things as well. So if you have an order from your doctor and you're designated as being high risk, your insurance company may cover screening at a younger age.
And cancer detection rates are different between the different types of testings?
Correct. The base imaging is going to be a mammogram, which will find between 5 to 7 cancers per 1,000 women screened. If we add in ultrasound, particularly for those women who have dense breast tissue on a mammogram, we will identify an additional 5 cancers per 1,000 women. And the MRI is the most sensitive test, which is why we utilize that in our highest risk population. MRI will tend to find 14 cancers per 1,000 women screened.
And is there legislation in Arkansas that affects payment and insurance payouts and that sort of thing that women are still paying?
There is insurance legislation, but it affects only the insurance companies that fall under state guidelines. So if your employer has a self-funded plan, it would not apply to you. But the state legislation provides that women shouldn't have to pay out of pocket for mammograms, ultrasounds, or MRIs when they're indicated.
From on a national scale, let's talk about Arkansas, but how does Arkansas compare to the rest of the country in terms of screening? Are we doing a good job here?
Unfortunately, we're not. When women were surveyed, about 64% of women indicated in the state of Arkansas that they had had a screening mammogram within the last 2 years. That's not even every year. So we're behind where screening is concerned. Unfortunately, we're also behind where mortality is concerned. So more women are dying in Arkansas compared to the surrounding states.
Well, tell us a little bit about what the resources that are out there and what CARTI is doing.
Well, for one thing, CARTI is bringing mammography into communities. So not only are we offering mammography services in Little Rock, we're also offering those same services in North Little Rock and Pine Bluff, as well as screening mammograms in Russellville. We have a couple of patient navigators that help facilitate that patient journey. For a lot of people, it's a lot to go from a screening mammogram to a callback to a biopsy to a breast cancer diagnosis and all of the things that come after that. So we currently have a nurse navigator and a patient navigator that help our patients at our 4 sites. Like you mentioned, we have the Cancer Genetics Risk Management Clinic to help us identify those patients at the greatest risk and follow them over time. We have 2 dedicated fellowship-trained breast oncology surgeons. They're both women. They do a fantastic job, Dr. Robertson and Dr. Fant. And they travel between the Little Rock, North Little Rock, and Pine Bluff facilities. And CARTI has even opened our own outpatient surgery center, which is right across the street from our Little Rock campus. So we've had patients ask us for years, can I have my surgery at CARTI? And now we can emphatically say, yes, you can. You can get your entire care here at CARTI. Some patients will require chemotherapy. So we have medical oncologists on staff, and many patients who get to have a lumpectomy, they get to keep their breasts, they'll require radiation therapy. And so CARTI offers radiation oncology at several of the sites as well.
It's really an incredible organization and location to do all of that. It really is. Tell me a little bit about muffins and mammograms. You guys are doing some fun things for October. You mentioned a couple of the others before.
So we're highlighting one clinic each week, and every patient that comes to that clinic for their mammogram that week will get a muffin. We started this last year by doing a few Saturday clinics and providing muffins, and we think it's kind of a fun way to make it maybe a little less scary to come get your mammogram. That incentive of a delicious baked good might make it a little bit easier for someone to pick up the phone and call and make that appointment.
And you guys also have a really neat outreach program. It's called The Bridge.
We do. The Bridge is an extension of the services of CARTI. It's all of those extra things like financial assistance, the navigation, social services. We even have an image center, for patients who are going through therapy and their appearance has changed. We have resources. And the Bridge has been undergoing a massive renovation, and we are excited to be reopening the new Bridge at the beginning of 2024.
And does the Bridge provide support services for different things, or is that a different group?
No, the Bridge is the umbrella for the support services for patients. So there are support groups forming for breast health services. Our navigators will be helping to facilitate those groups. The one for breast health services is not just for someone who's had a breast cancer diagnosis, but it's for any woman who wants to be actively involved in taking care of her breast health.
And you mentioned as well, in regards to support services, there is a patient assistance fund. What does that entail?
So we do have a patient assistance fund designated for breast center patients. For patients who qualify, they make an application through our financial counselors, and we can help a patient if she does have a portion that she would owe out of pocket. In the end, we do not want the cost to prevent a woman from getting the health care that she needs.
And you are doing a lot of really cool things, innovative ways to reach women in a younger and older generation. So tell me about the TikTok account that you have created and what you're doing, because you've gained a pretty impressive following.
Yes, Dr. Yara Robertson and I have a collaborative TikTok account under the Breast Friends, the number 4 Eva heading. And we have been, over the last 2 years, putting together some fun, some funny, and a lot of little educational videos. They're short, they're relatable. They try to make it a little less scary and help patients really get some quality information. We know that people are accessing social media formats to get information, and there's so much misinformation out there. We've partnered together to try to dispel some of those myths.
So it really is a TikTok Mythbuster account.
It is. I would say, like, some people paint for their hobbies or they knit. This is probably like our creative outlet hobby. We're putting together one because it's football season. I'll spoiler alert about how many people it takes to take care of the patient. And we'll just say there might be a pink football involved.
It does address, though, common myths as well. What are some of those that you hear a lot that is just not correct?
Well, so I've heard online that if you put your cell phone in your bra, that will cause you to develop breast cancer. There's really no science that supports that. One of the big myths out there is that having a mammogram could cause breast cancer, like having the compression from the mammogram could cause breast cancer, or even that the radiation from the mammogram can cause breast cancer. And neither of those things is true.
And aside from the innovative ways using TikTok and social media, you also provide a lot of educational sessions and webinars. If there is a healthcare provider group that wants to connect and learn more, how do they do that?
They can just reach out to me via my email. I should be fairly accessible. It's stacy.smith-foley@carti.com. I do education for technologists, for primary care providers, including gynecology, people who might be interested in doing risk assessment or genetic screening, as well as for other radiologists.
So as we close, Dr. Smith-Foley, tell me what are you wanting the general public, but the healthcare community to know about October and it being Breast Cancer Awareness Month? What is the message that you're wanting them to tell their patients in the community that could benefit?
Well, I think the main message is that the best we can do is to try to detect cancer at the earliest possible point. And our best method for doing that is with mammograms. So if you're 40 years of age or older, get your mammogram, set the example for your patients. If you have someone in your life, your spouse, your significant other that you care about, encourage them to get their mammogram. It's a form of self-care, kind of a self-love moment.
Well, I appreciate you joining us today and talking about the incredible programs that you have there. Then you're changing lives across the state, and I appreciate all the work that you do. Thank you.
Thank you so much for having me, Robin.
And that's it for this episode of AFMC TV. Have a great day, and thanks for watching.